Deep fascia in the forearm encloses the wrist and finger flexor and extensor muscle groups in a common sheath that are separated by an interosseous membrane. Posterior compartment injury occurs when you have a repetitive valgus stress resulting in medial olecranon process impinging on the posterior medial wall of the olecranon fossa as the elbow is brought into extension. So basically, you have a valgus extension overload syndrome. You have a valgus stress that injures the UCL, a lateral compression that injures the radial humeral joint, and then a posterior compression that injures the ulnar humeral joint. This usually occurs posteriorly on the superior medial corner of the olecranon process and the corresponding fossa. Additionally, you may find injury to the extensor muscles of the wrist and fingers, often secondary to an elbow fracture or dislocation, a crushing injury, a forearm fracture, post-ischemic edema, or excessive muscular exertion. This type of injury is going to occur more commonly in the mature athlete, and you will see that the valgus stresses are associated with acceleration, deceleration phases of throwing and improper mechanics such as sidearm throwing. In a posterior compartment injury, onset is rapid, and you will find swelling, dislocation, an absent or diminished pulse, a subsequent onset of sensory changes or paralysis, and severe pain at rest that is aggravated by passive stretching. You will also find pain at the posterior medial ulnar humeral joint and pain with pitching during acceleration into deceleration. Common in pitchers, the range of motion will be decreased extension. The valgus stress test can be performed. The stretching of the UCL leads to valgus laxity, which can worsen the problem. An ulnar nerve assessment should be performed. Treatment will be surgery for joint debridement and UCL stabilization.